Hi there, welcome to the latest episode of my 10-minute moan. And the topic of this 10-minute moan is the shocking stats that have just been released, telling us that alcohol deaths in Scotland are at a 15-year high. And this is bonkers, because the SNP have been telling us that minimum price of alcohol was going to somehow change our habits as Scottish people and help affect this. But even more amazing is some people are actually complimenting the results. Some professionals, and blaming other people. Somebody else's fault. It's not just the government's fault for doing nothing, or at least nothing that made a difference, because obviously the price of alcohol is not bringing down the deaths. So, where are the figures? Data from the Office of National Statistics released on Wednesday found that there were 1,277 deaths from conditions caused by alcohol in 2023. The new data shows an increase of deaths compared to 1276 recorded the previous year. And in 2023, there were 10,473 deaths from alcohol-specific causes registered in the UK, which was the highest number on record. Scotland continued to have the highest rate of alcohol deaths in the UK at 22.6 for every 100,000 people. Northern Ireland was second at 18.5 per 100,000 people. The numbers recorded were 4.2% higher than 2022 and 38.4% higher than 2019, which was the last year before we had the pandemic and we all got locked up and a lot of our stuff did change. There was a rise of 37% among women and 39% among men. Between 2012 and 2019, rates of alcohol-specific deaths in the UK had remained stable with no statistically significant changes in the age standardised rates. Dr. Alistair McGilchrist, chair of SHAP, said the statistics show devastating harm alcohol causes across the UK and added that every single life is preventable. He said it's more urgent than ever that governments take action than needed to tackle this public health emergency. Dr. McGilchrist said while Scotland had introduced policies such as minimum unit pricing, more needs to be done. We also need a range of preventative measures which tackle the marketing, price and availability of alcohol on a population level. It's absolutely crazy. There was some people, Laura Mahon, Deputy Chief Executive of Alcohol Focus Scotland, said the latest figures demonstrated that Scotland and the UK is firmly in the grip of an alcohol emergency. The truth is the majority of these deaths, most caused by liver disease, come as a result of people drinking heavily over the course of many years, with 1 in 5 Scots drinking at a level which could be harmful to their health, including increasing the risk of liver diseases and cancers. Pretty frightening. She said that the COVID pandemic had exacerbated drinking patterns and saw those who were already drinking heavily increase their consumption. Alcohol remains at the centre of culture and social life in Scotland, a position which the alcohol industry works hard to maintain by spending huge amounts of money on advertising and sponsorship to normalise drinking and influence our consumption habits. So what she's doing is she's pointing the finger at the alcohol industry, and without even looking, I will bet my bottom dollar that Alcohol Focus Scotland is funded by Scottish Government. If I'm wrong, prove me wrong. So she's saying it's their fault. Now, forgive me if I'm incorrect here, but I already believe there are sanctions against alcohol companies and sponsorship and advertising. So I'm unsure what more they could do if it's their fault. And surely if that is the problem, then it's down to governments to control the marketing and the sponsorship, and it's not the industry's fault. So we have to actually stop pointing the finger. We're doing it again with something that is absolutely deplorable, because people are dying, and people are dying in Scotland more than anywhere else in Scotland, England, Northern Ireland and Wales, by some way, between the second place, which is Northern Ireland. So what did it do? I think ties in well with the issues we have with drug problems and drug deaths, where we don't actually deal with the problem. We've opened up a consumption room in Glasgow and people think that's going to miraculously solve the problems we have with the drug deaths in Scotland, which are the worst in Europe. But there's only about 30 people a week maximum using the place. I don't know how that's going to work, even if the thing works at all. So again, the Scottish Government bring out things like consumption room, like the minimum pricing for alcohol, for absolutely zero effect. They're headline policies that do nothing. And time again, it's proven that these policies introduced by the SNP have absolutely zero impact on the devastation that it's causing in people and their families' lives. A, when they're addicted to whether alcohol or drugs, and B, if they're unfortunate enough to pass away. These people deserve better. And we need to stop pointing the finger of blame externally and take ownership of the problems and go and do something that works, not minimal pricing. Because the unit pricing thing is obviously failed, and anybody that says otherwise is howling at the moon. So if you enjoyed this video, please give it a thumbs up. If you've not already done so, please hit the subscribe and the notification bell. Let me know your comments below, they're always good. But most importantly of all, unless you're the type of person that sees these figures, the worst in 15 years and the worst in UK, and wants to blame other people, not you, but
everyone else, have a great day. Cheerio, bye now.